When we are grossly examining an organ, we look for the two things. One is, can we identify the organ, and the other is, can we identify the pathology. So there are four main things that we look for in an organ when we are grossly examining it. One is the size of an organ, whether the organ is atrophied or hypertrophied, or is it of a normal size. Second is the shape of the organ, whether it is deformed or whether it's normal. Then we go for the consistency, that is it soft in consistency, hard in consistency, granular, etc. And the most important is the color. In the cross examination, we look for the color changes, and that tells us about the pathology that an organ. For example, this is an image from Wikipedia showing the lung, and what we can see is the color changes in the lung, that we can see the black spots in the lung. So these are the black spots, and we call it the anthracosis, deposition of the black particles in the lung. And there can be different options that give the black deposition of these black pigments in the lungs. One can be the smoke, whether the patient has been smoking or he has come from the fire in the house or something like this. And or we can say that the patient is a coal miner. So but we can also but in this diagram we can see that there are holes in the upper area of the lungs. So what we can say that we can identify it as the emphysema. Why? Because we can see the holes in the lung. And now, how can we differentiate between centriacinar and panacinar emphysema? So one thing that we should keep in our mind is that the smoke rises up. So in smoking related emphysema, you will see the holes on the upper part of the lungs, not in the lower part of the lung. And the other thing, like you can remember it like the smoker gets centriacinar emphysema for smoke and for centriacinar. So smokers get centriacinar emphysema. So as we discussed the gross examination, that when we examine the organ, we look for these four things. Now we come to the microscopic examination. Pathologists use three techniques to identify an organ pathology. Those three techniques. These are staining technique, ancillary techniques, and molecular techniques. So in staining techniques, they are going to stain the part of the organ and look it under the microscope. And there are different types of stains that they are going. And the most important stain that they are going to use is H and E stain. That is called hematoxylin and eosin stain. So the cells will appear blue when they are stained with hematoxylin, and they will appear pink stained with eosin. So what part of the cells microscopically they stain blue, and not all things stain blue, some things stain pink. So what part of a cells are going to be stained blue? So we are going to remember them by the mnemonic NBC. They are nuclei or nucleoli. Then we have bacteria that are stained blue with hematoxylin, and then we have calcium that is stained blue. And what things are stained pink? All other things that are protein, like P for protein, P for pink. So they are going to be stained pink. Only nuclei, bacteria and calcium are going to be stained. The other stains that we are going to use are, what I want to say is the Prussian blue stain. Prussian blue, and it's gonna stain iron in our cells. Most commonly it is used to stain, like we are going to identify hemochromatosis for that, and other one is we can use Congo red stain, that is diagnostic for amyloid, and we can also use acid fast stain, and it is, as we know, that a very important bacteria that is going to be stained by this is Mycobacterium tuberculosis, that is going to be stained by this, and also Nocardia and Cryptosporia. Okay, now the other stain that they are going to use is PAS, and what this PAS is for, it's going to identify the high carbohydrate content molecules, high carbohydrate content into the cell, and so there are few conditions that I've mentioned that are PAS positive. One is diabetes mellitus, glycogen storage disease such as McArdle, von Gerke or Pompe disease, alpha-1 antitrypsin deficiency, I think so, alpha-1 antitrypsin, sorry, that is going to be stained with PAS. Some fungi have high carbohydrate content in their cell wall, Whipple's disease, AML-M6, and Paget disease of the nipple is going to be stained positive with PAS. The other stains that we are going to use are the Gram stains that are going to stain bacteria, Trichome stain that is going to stain cells and connective tissue, and reticulin stain that's going to stain type 3 molecule. As we mentioned that these were all the histochemical stains. Now we come to immunohistochemical stains. So these are basically antibody stains, and there are 4 main types of stains that we use in this category. One is cytokeratin that we use to stain epithelial cells. The other is vimentin that stains the mesenchymal origin cells except the 3 muscle types, and this stains many sarcomas. Desmins are the one that are going to stain these 3 muscle types that are smooth muscle, cardiac muscle, and skeletal myosin. And then the last but not the least is prostate specific antigen that we are going to use. Then we come to the ancillary techniques. We have 2 techniques in that. One is IFM, immunofluorescence microscopy, and the other is transmission electron microscopy. Immunofluorescence microscopy includes um, like renal disease, we are going to identify renal disease using this type of technique, and also the autoimmune disease. In transmission electron microscopy, we are going to identify these four conditions, that is renal disease, neoplasm, infections, and genetic disorder. You can remember it by a mnemonic ring: renal disease, infection, neoplasm, and genetic disorders. Then we come to the molecular techniques, and there are four techniques used in this, that is protein electrophoresis, southern and western blots, PCR, and cytogenetic analysis that includes karyotyping and in situ hybridization studies.